Hi, my name is Ellie, and I'm a first-year student in the BSN program here at UC. For this project, I chose to research and practice aromatherapy. This wellness practice is a holistic healing treatment that uses natural plant extracts to promote health and a well-being overall. Aromatherapy can be classified in many different forms based on the use, such as cosmetic, massage, medical, olfactory, and psycho. The practice can be conducted in a variety of ways, such as diffusion, oral consumption, topical, and cosmetic products. Personally, for my experimental portion, I used 3 different types of essential oils: tea tree, lavender, and grapefruit, and a steam-based diffuser, which I would use for 30 minutes 3 times a week. I studied how my heart rate and emotions were affected by the essential oils. After completing my experiments and forming conclusions from my data, I found that overall the essential oils had an impact on my heart rate, most of the times lowering it, but it depended on which type of oil I was using. It also had an emotional impact, such as calming or lowering my anxiety levels, also sometimes increase energy levels. Also, I interviewed Ms. Staubau, who is a registered nurse that uses aromatherapy for her ICU patients in a hospital setting, and learned a little bit more about aromatherapy through her. Along with conducting the experiment portion of this project, I also found a variety of literature pieces on the topic of aromatherapy. The main topic that I researched is the effect of aromatherapy on anxiety, specifically within the world of PTSD. I found that certain smells, which the oils can mimic, often are tied to a memory for the patient. These memories can rather induce a panic state, which is called heightened in use in exposure therapy, or it can calm the patient, known as grounding, which is helpful when they are in a panic state. This process is known as an emotional-induced aromatherapy setting. Majority of the articles that I found were popular literature pieces. Many popular psychology websites or journals have studied the practice of aromatherapy. Often the article took the stance that aromatherapy has little to no effect on the user. But these articles also had little evidence on or varying opinions. Contrasting the popular literature pieces are scientific literature pieces. Aromatherapy has little research conducted due to the difficulty of collecting accurate data, due to not knowing if it was the aromatherapy or a different thing affecting the user. However, the research that has been conducted in a proper manner is very reliable and supports much of the scientific conclusions on wellness practices out there, and specifically with aromatherapy. Overall, the practice of aromatherapy is something often overlooked in popular society, but truly does contain many benefits. Aromatherapy can be used for a variety of purposes and in a variety of ways depending on the desired outcome. For example, grounding aromatherapy is often in the form of oil application. Rather, the use is for emotional or physical purposes. Aromatherapy is an easy, well-diversified, and simple wellness practice that will leave the user in a better health and mental state overall. Thank you.